What would happen if you stopped brushing your teeth? Starting today. Not for a week, not for a month, but forever. Imagine waking up without that feeling of freshness, a smell you can't hide, slow destruction that begins quietly, without pain, without warning, and then one day, it becomes too late. Many people think the worst outcome is a cavity, but the truth is far more disturbing. The consequences can affect not only your smile, but your entire body. Let's walk through the full timeline of what happens when a person stops brushing their teeth. From the very first days to serious disease. And after hearing this, you may never look at a toothbrush the same way again. Most people have skipped brushing at least once and noticed nothing critical. That creates a dangerous illusion. If nothing hurts, everything must be fine. But dental problems almost always begin silently. Oral diseases remain among the most common health conditions in the world, and many people discover them too late. Our brains react to pain. Until pain appears, the threat feels unreal. Yet tooth destruction rarely starts with sharp pain. It develops slowly, step by step. The most dangerous part of this process is its invisibility. You can feel completely normal while bacteria are already at work. Just hours after your last brushing, plaque begins to form on your teeth. This is not simply leftover food. It is a living colony of bacteria. They feed on sugars, multiply rapidly, and create a sticky film dentists call biofilm. You may not see it, but you can feel it. Your teeth begin to feel slightly rough. By the end of the first day, a mild odor appears, subtle but noticeable. On the second and third days, bacterial numbers increase dramatically. The biofilm thickens and begins protecting microorganisms from outside influences. Many people believe rinsing their mouth is enough, but rinsing does not break down biofilm. It removes only some of the free-floating bacteria. The primary threat remains, and the process has already begun. After about a week, the soft plaque starts to harden. This is how tartar forms. At this point, an important turning point occurs. A toothbrush can no longer remove it. Your gums react first. Inflammation appears, along with redness and sometimes slight bleeding while eating. This is no longer a cosmetic issue. It is a signal from your immune system that an infectious process is developing in your mouth. Many ignore these signs, blaming sensitive gums. In reality, the body is already fighting back. And most concerning of all, this is only the beginning. If nothing changes, bacteria gain ideal conditions to attack. A cavity is not just a hole in a tooth. It is a bacterial infection that gradually destroys enamel, the hardest material in the human body. At first, you may notice sensitivity to cold or sweet foods, then discomfort, then pain. The infection moves deeper, toward the dentin and the nerve. At this stage, the body can no longer stop the process on its own. Without treatment, the tooth begins to break down from the inside. Eventually, extraction may become the only option. But even that is not the greatest danger. The mouth is not an isolated system. It is one of the body's main entry points. Bacteria from inflamed gums can enter the bloodstream and travel elsewhere. Research shows a connection between chronic oral infections and an increased risk of cardiovascular disease. Constant inflammation places a heavy burden on the immune system. The body spends energy fighting infection instead of protecting you from other threats. Your mouth can literally become a gateway for disease. The good news is that the human body has a remarkable ability to recover. In the early stages, many changes are reversible. Gum inflammation can be stopped, plaque can be removed, risks can be reduced, but this ability is not limitless. The longer treatment is delayed, the more complex and expensive recovery becomes. Sometimes a professional cleaning is enough. Other times, serious intervention is required. That is why prevention is almost always easier than treatment. Your future health is largely shaped by the habits you build today. Brushing twice a day mechanically disrupts the biofilm, the environment where bacteria live. But frequency is not the only factor. Technique matters. Brushing too hard can damage your gums, while brushing too quickly can leave plaque untouched. Even careful people often make mistakes, brushing for too little time or skipping hard-to-reach areas. Preventive checkups allow problems to be detected before they become serious. Sometimes, 2 minutes a day truly changes everything. Even occasional skipped brushings can trigger a chain reaction if they become a habit. Remember, the absence of pain does not mean the absence of disease. Genetics may influence enamel strength, but they do not make anyone invulnerable. And youth is not protection. Bacteria do not care how old you are. The most serious problems often begin when a person is convinced it could never happen to them. Think about this contrast. 2 minutes a day, or years of complex treatment. Brushing your teeth is not just hygiene, it is a form of insurance for your health, a small daily action that protects you from major consequences. Sometimes the most important habits are the ones we barely notice. If this made you see a simple toothbrush differently, then it has already done its job. Subscribe to the channel to learn more surprising facts about the human body and the hidden processes that shape your health.